Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about population health and some home-based services St. Tammany Health System offers to help the health of our population. We're going to start this morning with Dr. Michael Hill, Vice President of Quality and Utilization Management. Dr. Hill, welcome to the show.
Good morning. It's great to be here again.
I'm excited to have you here again and to have you here in your official capacity as Vice President of Quality and Utilization Management. Because I feel like for the last 2 years, every time I have you on the show, we are talking from your medical specialty of infectious disease, and we are talking about COVID. And I'm really excited today we're not talking about COVID.
I am too. This is a lot more fun than COVID.
Absolutely. And quality and utilization management, and a term that I used at the beginning of the show, population health, those are all some healthcare industry terms that we throw around rather casually, and you really spend all of your time in when you're not fighting COVID.
Right.
And I think if you can start off just defining a little bit about what population health means, that's going to help our audience know what's important about that for them.
Sure. So really at St. Tammany Health System, we're just not a hospital anymore. We really are a health system. We want to get into the community and promote wellness and promote people transitioning from the hospital to the home and getting the best care they possibly can. And so we have several initiatives in population health. One of them is improving the health and well-being of our community from birth all the way into the elderly. And I think that we have a great opportunity to take a healthy community and make it even healthier and avoid situations where people get in the hospital that might be avoidable. And so that's everything from cancer screenings to watching your cholesterol, to not smoking, to doing watching your weight, exercise, all the things that we know to be good for your health.
Well, to me, that's what's interesting about it. In healthcare today, we have recognized as an industry that all of those things that we know are good for us don't happen by themselves, and that we need management and programs and clinical care that focuses on the things you just mentioned. You know, population health is achieved through early detection. It's achieved through wellness programs. It's achieved through recognizing that when someone is well enough to be discharged from the hospital, they're not back to normal, and that there are some transitional helps that our organization needs to give to its patients.
Absolutely. And it's important that we transition the patients in a safe, proper way. And one of the nice things about transitional care, home visits for example, is it allows us to go into the home and see what are the issues that the patient might be facing that the patient doesn't even realize or the family doesn't realize.
Now that's pretty fascinating, and I think it'll be interesting when our next guest, Gabby Silva, really dives into transitional care, because you're right, there are so many things in our lives that we just take for granted. This is my home, this is my yard, this is my vehicle, and this is my life the way my life is. But those are all places that can actually introduce risks for patients, or they can be impediments to patients' good health.
Right, and I think that's very important. And just going back for a minute, something you talked about earlier, about 20% of healthcare really is managed by the physician or in the hospital. 80% is outside of the traditional healthcare model, and that's what we're trying to touch on, is get to that other 80%.
And I think that's the funny thing about population health, is recognizing that it isn't just about a doctor's visit or a stay in the hospital or a surgery or other procedure. All of those things are important, but those things can be encompassed in that little 20% wedge that you mentioned.
Right.
That 80% is our lifestyle, it's our family, it's all of the things that contribute to our daily lives. Maybe we work in a dangerous job, or maybe we make lifestyle choices that are not healthy.
Right.
And all of those things contribute in that 80%.
Absolutely. And I think one of the other things that we've begun to look at are what we call social determinants of health, which are very important. And one of the things that we realize in older people is social isolation can be a real issue, and trying to deal with those issues and and even going out and making sure that somebody goes and visits the individual or the family so that they're not isolated, because that really does affect health care, mental well-being, and determines outcomes of a patient's health.
You know, that's two things that I'm hearing you talk about as you're describing population health, and one is there's a mental health component, and the other is that we have to get out into the community if we're going to be successful at improving the lives and health of our population.
Absolutely.
And I think St. Tammany Health System has invested in a program called Healthier Northshore and an asset called the Be Well Bus. And I think both of those are really good examples of our population health initiative.
Right. So, you know, population health is getting out in the community, promoting health screening, which the Be Well Bus does, taking health care to where you are, because not everybody has the transportation or the means to get into a health care system. And really making the community aware what services are available, and the fact that if you get cancer and detected in an early stage, that you're much more likely to have a cure or a successful outcome. So those are very important things. And one other thing I'd touch on is we talk about population health in the aggregate, but when it comes down to it, population health is really about taking care of the individual and individualizing care.
I love that, individualizing care, because we have a tendency to think, okay, here's how you take care of people. We just need them to quit smoking and get their screenings and come in once a year and everything will be fine. But for each person, it's not just about their physical health. It's about their emotional, social, and mental well-being. It's about their home life. And all of those factors are different for every individual.
Absolutely. And you need to tailor the programs that we bring to people based on what their needs are. And that's what individualizing care is all about.
And that's what population health is all about.
Absolutely.
So that is fantastic. Well, Dr. Hill, thank you so much for coming in, for talking about quality utilization management and population health instead of about COVID.
It's great to be here. Thank you,
We're
Melissa.
really glad you were here. Thank you.
Thanks.
You're watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about population health and home-based solutions for the health of our local community. We'll be right back.
Here on the North Shore, along these halls, there are many minds at work. At St. Tammany Health System, many innovations happening now, and even more on the horizon. Many reasons we're number one.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. We're talking today about population health and some home-based solutions that help us to improve the health and lives of people who live in our community. We spoke first with Dr. Michael Hill, and he talked about population health. Up next, we're talking with Gabby Silva, who is going to teach us about transitional care. Gabby, welcome to the show.
Thank you very much for having me.
Really excited to have you here and to learn about transitional care, because Dr. Hill referred a little bit to it in his segment, but I think transitional care feels like a little bit of a blind spot for a lot of people. We don't even realize this is an aspect of health care. When you get out of the hospital, you've been discharged from care, you're headed home, you're not sick enough to require home health care or to be admitted into a long-term care facility or a rehab facility, but maybe you need some help in the middle. And so if you can, talk to us first about what is transitional care.
Okay. Well, traditionally, what transitional care was, it was more of an outpatient clinic. And historically, patients would come from the hospital, they would go home, they would be discharged, and they would go to a clinic to review their discharge instructions or medications and things like that. But with all the other appointments that they have to make, you know, we changed the program, several years ago. It was changed so that now we're going out to the patient's home, or we're calling them, within 2 days of them being discharged, and we're making sure that they have everything that they need in their home in order to be successful and make sure that they don't, have to go back to the hospital.
Well, and I think that's what's really beautiful about it. You're recognizing that the hospital was able to get this patient through a surgery or whatever procedure took them into the hospital in the first place and get them well enough to be discharged home. But then there are follow-up responsibilities that patient needs to make. They need to see certain specialists or maybe their primary care, and you can ensure that they get those things done, and you can help them not wind up back in the hospital again, which is so important for their their longevity,
Right.
And their overall long-term health.
Right. The way that I like to put it is, the patient is discharged from the hospital, and once they're home, they don't know where to start. They have to go to their cardiologist or to primary care, pulmonology, nephrology. Where do they start? So in a way, we're bringing our information in, and we are making sure that we're aligning them in the right direction. We want to make sure that they do follow up with all of their providers, they take all their medications appropriately, and take a little bit of that burden away from them of, doing it by themselves. And ultimately, if they're discharged from the hospital and we see that they do need a little more extra care, we can also help with getting that referral to, home health or for home sitters, a referral for food in the community. If they're not able to eat, they're not able to take care of themselves at home. So.
And I think that brings up that interesting point Dr. Hill was referring to. He talked about, if you look at healthcare as a pie chart, only 20% of healthcare is really provided, at the hospital or the doctor's office or what have you. The other 80% is really in our own lives, in our homes, in our workplaces. How we go about our day-to-day life has impact on our health and well-being. Right. And you just mentioned food insecurity, and I think that's something that we so often overlook and don't realize how many people may have fragile access to food. They may have income issues. They may live in an area where grocery stores are not abundant. And so you're suggesting then that as transitional care professionals, by not having transitional care in a clinic, but in the home, you are able to see some of those social determinants.
Correct.
That help to determine how healthy this patient is going to wind up over their lifetime.
Very, very true. I mean, some people don't have transportation at all. If they're calling the ambulance to take them to the hospital, then how are they going to get to their primary care doctor? So how are they going to go to the grocery store? How are they going to go to the pharmacy to pick up their medication? So thankfully, in the community, we do have a lot of resources, to bring meals to the home. There are a lot of resources for, let's say, pharmacy to be delivered, medications to be delivered as well. So we have that information in transitional care, and what I love is being able to bring that information to the home, to the patient, and give them that peace of mind that, there's help out there that we can help you with.
That is beautiful. And one of the things that Dr. Hill mentioned was individualized care. And what I hear you saying is that's what you're able to do. You bring a toolkit of resources, of what's available in our community that can help this patient. And you can go to their home to help them determine what are the best ways for them to get the food, the medication, the transportation that they need to get back to normal and get on with their life.
Right, and education as well. What I love to do is, when I get my appointment for my patient, I'll review the patient's chart or make sure, if they're going to the hospital several times for, let's say, congestive heart failure, has there been a time that the patient has absorbed the information of how to take care of themselves? So in the office, we have several materials where we can pull from and bring that tailored information to each patient and make sure that we walk through it with them, explain it to them, and kind of, get their feet wet with, their own health care. If they don't know what they're doing, they don't know where to start, and we bring that information to them.
Well, and that's understandable. You have, healthcare can be so overwhelming when you don't understand what you need to do. And if you keep winding up back in the hospital for the same issues, then to be able to take that step back and examine the whole picture of a patient's life and home and help them to know what the resources are, but also what the actual lifestyle changes and decisions that need to be made are. So to talk to someone about quitting smoking, for example, and when you talk to them about eating right, to be able to understand how to get the resources to get that healthy food, right. So that they're not in a situation of either not having food at all or maybe having foods that are counterproductive in the home.
Right.
This is just fascinating because I love the idea that you're able to take the best practices that we know are what we should all be doing, but be able to sit down with an individual case and think about what among those best practices really apply to this person, and then to go visit with that person and maybe their family or loved one in the home.
Right.
Which I think really makes a difference, because then as the patient or as their family member, you're able to hear firsthand, for this patient, for me, myself, or for my loved one, these are the things that we need to accomplish so that we don't wind up back in the hospital again.
Right.
Gabby, this is really wonderful. I love this transitional care. Thank you for coming in to teach us about it.
I greatly appreciate it, and I just love going into the community and giving them that information and empowering them so that they feel successful outside the hospital.
That is beautiful. Thanks for coming in.
Thank you very much. I appreciate it.
You're watching Healthy Living, brought to you by St. Tammany Health System. We're talking today about population health and some home-based care solutions that help individuals in our community to lead healthy lives. We'll be right back.
Just this morning, optimism and strength prevailed. Many hopes became reality at St. Tammany Health System, dedicated to more little miracles. And the bigger ones, too. One of many reasons we're number one.
Welcome back to Healthy Living, brought to you by St. Tammany Health System. We're talking today about population health, and we learned a little bit about how population health helps us to take care of our community, and we learned about transitional care. Next, we're going to learn about annual wellness visits and how those can help out in the home. Welcome, Caroline Barkerding.
Thank you.
Glad to have you on our show. Now, Caroline, you're a nurse practitioner and you work in home care, but you are focused on something called an annual wellness visit.
That's right.
So maybe let's start at point A and describe that for us.
Sure. So the annual wellness visit is just a yearly exam with your primary care provider to go over your current health status, your risk factors, and try and develop a personalized plan of care. A big benefit of the annual wellness visit is most of the time it's covered free of charge to the patient by Medicare.
Oh, wow, okay. So if you have this annual wellness visit, you may not even realize you're doing that. You go in for an appointment, you take care of the annual wellness visit, but there's a real reason to be doing that, and the value in that. I guess it's for people to understand why they should have a wellness visit, It's not just to check a box, not just to say you did it, but that really adds to longevity.
Absolutely. So during the annual wellness visit, what we'll do is we'll go over your past medical history, we'll discuss your family's past medical history, we'll go over what healthcare providers you're following with currently and whether or not you need to follow up, and we'll go over any medications that you're taking at this time. We'll go over what's called a health risk assessment, which essentially will just paint a picture of what your daily routine is as well as your functional status. We also will do routine vital signs, blood pressure, height, weight, We also add in some extra assessments just to make sure that everything is staying on track. We do cognitive and memory assessments. We do depression screenings. We do nutritional assessments. We assess whether the patient is at risk for falls and other health measures.
Wow. So you really get a very full picture of each individual patient and have an understanding of their general situation so that they can try to stay healthy. And if they have chronic diseases, how to manage those well.
Absolutely.
Okay. And I know one of the aspects of what you're accomplishing is advanced care planning. So maybe you can talk a little bit about what advanced care planning is and how that relates.
Absolutely. So that's a big topic that we touch on during the annual wellness visit. So advanced care planning, we educate patients on living will and LA Post, which are just both documents that specify what the patient would want at the end of life if they were no longer able to communicate that themselves. We also really encourage patients to assign a healthcare power of attorney, which is essentially a person who is going to make medical decisions on the patient's behalf if they were no longer able to do so themselves.
Okay. So really, at the annual wellness visit, it's more than just your vital signs. Like you said, we're going to talk about your family history. We're going to talk about your current life and what's going on, because that helps us understand what your health situation is. If we have chronic diseases, we're going to talk about those and how to manage them. But then also to have a plan and a thought about, in the course of our lifespan, none of us likes to think about this, but none of us is getting out of here alive. We're all going to go sometime. And so advanced care planning is a really important way for us to do that in a manner that really puts some thought and planning into how we want our life to end and how we want our family to be able to be managed and supported through that process.
Absolutely. It's not the most fun conversation, but it's definitely necessary. Whenever you plan, advanced care planning and you put those documents in place, it really does take the burden off your family members having to make those really tough medical decisions in the event something does happen.
Sure. And obviously the time to do that in an annual wellness visit when nothing is wrong, that's a good time to be thinking about these kinds of things, because we can take facts into consideration. We can think about our family and what their needs might be, and we can sign that paperwork and put it away and then just not have to think about it again for maybe decades.
We like to review it at least once a year just to make sure that your wishes are still reflected in whatever documentation that you signed. So that's one thing. It's once a year you look at and you make sure that you're still happy with what you put down, and if not, we make changes.
There again, that's the annual wellness visit.
Right.
So now we are talking today about population health and home-based solutions that help us to achieve those goals. And you and I have been talking about annual wellness visit, which any of us can do with our primary care and should do with our primary care. But you actually have a new program that's taking the wellness visit home.
Absolutely. So there's a lot of advantages to doing the annual wellness visit in the home. It allows us to actually reach out to those patients and care for the patients that have trouble getting into that office. They could have trouble getting in either through debility or transportation concerns. We've even had patients that feel uncomfortable coming into the clinic through COVID concerns, and we're able to reach out to them and make sure they're getting the care they need.
Fantastic. So you're essentially taking that annual wellness visit that we talked about, and you are transporting it into the home environment for that individual and maybe their family member to be along, just like you would at the doctor's office. And the idea behind that being that you can see the environment, you can help this patient to have an awareness of what is contributing to their health and what maybe is a detractor to their health there in the home environment.
Absolutely, exactly. I think you get a better picture of the patient and exactly what's going on when you're in the home rather than in the clinic setting.
Well, and I think for a lot of us, we put on our calendar to go see our physician annually. Maybe we tie it to a birthday or some other trigger that tells us, okay, time for the annual physical. But in this case, you're talking about a special population of people who qualify for home-based care. So can you talk a little bit about how people can access home-based wellness?
Absolutely. So any patient that is due for their annual wellness visit through Medicare, they're all eligible for the annual wellness visit in the home. Usually they're referred by their primary care provider. They can also call their primary care provider at St. Tammany and request to be seen in the home rather than the clinic setting.
Okay, so it sounds like it's a Medicare-driven program. Yes. So anyone who's Medicare eligible or already a Medicare patient has access to this.
They do.
And they can choose to do that through their established primary care provider, or they can contact our office, and they can do that on the website or at the office.
Absolutely, yes.
Very good. Well, I think, you know, we're talking about something that all of us sort of take for granted, annual physical, but we're talking about it in a way that really defines how that physical keeps us healthy, helps us to manage a disease we have, or maybe keeps us from developing severe disease at all, and hopefully keeps us out of the hospital.
That's our goal, absolutely.
Outstanding. Well, Caroline, thank you so much for coming in. It's been a pleasure to have you here.
Thank you for having me.
You're watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we were talking today about population health. We also examined some home-based solutions that help us to take care of individuals throughout our community. We'll see you next time on Healthy Living. Welcome to St. Tammany Health System, where we've been the heartbeat of our community since 1954. A lot has changed since then. In fact, we've never stopped evolving in nearly 7 decades, transforming from a 1950s small country hospital to today's nationally recognized regional health system. We serve patients from more than 25 sites throughout West St. Tammany, from pediatric and primary clinics to specialties including orthopedics, cardiology, pulmonology, and surgery. To help our doctors and nurse practitioners diagnose and treat your needs, we offer a litany of diagnostic and therapeutic facilities, from lab and radiology to our breast center of excellence, the Women's Pavilion, and comprehensive outpatient rehabilitation with pediatric and adult locations. Possibly the most comprehensive of our off-site locations is St. Tammany Cancer Center, a campus of Ochsner Medical Center, which houses the single largest, most advanced cancer program on the North Shore. Then, of course, there's the flagship, St. Tammany Parish Hospital, ranked by Leapfrog, Healthgrades, Quantros, U.S. News & World Report, and the Centers for Medicare and Medicaid Services. The national ratings agree St. Tammany is a 5-star hospital. Our tour begins in the beautiful first-floor atrium lobby of main campus. Just around the corner are accredited radiology and laboratory departments, as well as our exceptional emergency rooms. We're certified for chest pain, stroke, and trauma, and we're home to the area's only pediatric emergency room, plus an off-site ER in Mandeville. On the hospital's second floor, you'll find our suite of operating rooms, staffed by a team of certified nurses and surgeons, with access to some of today's latest technology, including an array of robotic systems to assist in general, orthopedic, and neurosurgery. On the third floor is our new family center, where our maternity team makes sure new parents and their babies feel comfortable, coddled, and cared for. So far, we've birthed more than 60,000 babies and counting. In spring 2021, we cut the ribbon on our newest addition, a purpose-built patient care tower designed with input from our caregivers, earning it the nickname the house that nurses built. It houses all private patient rooms, intensive care, additional operating rooms, and the administrative conference center. The completion of that addition allowed us, for the first time in our history, to make every patient room a private one, which, as much as anything, embodies the patient-first mentality that drives everything we do here at St. Tammany Health System. All of that really just scratches the surface of what has made St. Tammany Health System the premier healthcare destination for our North Shore neighbors for nearly 3/4 of a century. Here, we're not just a collection of doctors and nurses, we're your family, we're your neighbors. From the beginning, we've been woven into the fabric of our community. Today, all these years later, we're still as committed as ever to the idea on which we were founded, providing the people of the North Shore with world-class healthcare close to home.